Hundreds of people injured in Las Vegas went to a number of hospitals.
And that's something Liz Bonas found would also happen here in the tri-state should we have a similar mass shooting. Liz?
Hey guys, good afternoon. Every provider that works in emergency services is required to undergo active shooter training in their own healthcare setting, and then also in how to help in a mass casualty or transport if one happens nearby. So we stopped out today at St. Elizabeth Healthcare to share a community-wide program that would help us manage two of the big challenges that they had after this gunman opened fire. One of the biggest challenges for healthcare providers in Vegas right away, identifying the urgency levels of those wounded. That way the most wounded get transported first. Those in the field often use a color-coded tag system. So for example, a red tag patient after evaluation may be urgent for transport right away. Mike Kraft says his community response team at St. Elizabeth trained much in the same way.
We work with local Homeland Security on things such as identifying victims and where they're going and how to get family members to them.
The family member communication, that was the other challenge for the Las Vegas teams today. To address that here, there's a coordinated Greater Cincinnati Health Council network.
So there's actually radio communication with all the emergency management, all the first responders and all the hospitals in Greater Cincinnati. So they'll open what's called the hospital net, and we will hear where patients are going. And then we'll get on to the computer, the system, and we're all linked in together.
That means hospital patients are linked on a Greater Cincinnati citywide computer program.
And we're able to see what patients go to what hospitals. So if someone shows up here and their loved one is actually at Good Samaritan, we're able to tell them that.
Now, some of the care for those wounded started with the friends and family all around them. Many were able to help save lives by stopping the bleeding. There is now a special training program for all of us that we could learn more about that too. And we're going to share more about that coming up on Local 12 News at 5:30. Guys?
All right, Liz.